More than 2,700 people are currently waiting for organ transplants in South Africa. The health department is now calling for donors. It's dismissed claims that religious and cultural beliefs are preventing people from donating. Well, for more on this, I'm joined now by the spokesperson for the Department of Health, Foster Mohale. Mr. Mohale, good afternoon. Thank you very much for your time. Welcome to today here on eNCA. Organ donation is always a sensitive matter for many people, besides the lack of awareness. What are the key factors that you have discovered? Before we discuss further your appeal, what are the key factors or reasons you've discovered people would advance in terms of not donating organs?
Good afternoon, Dan, and good afternoon to eNCA, and thanks for this opportunity. Yes, some of the findings that we discovered related to lack of donation of organs is because of, number one, is limited knowledge in terms of organ donation. As you know, that most people by now, they are aware that there is what we call the blood donation, but in terms of organ donation, there's a limited knowledge. But also some of the barriers are religious and cultural beliefs. But we believe that we can overcome this as long as we can raise awareness, work together with all the stakeholders in the community to raise awareness about the organ donation, which is a life-saving organ.
Yeah, so when you donate an organ, you are saving somebody's lives. That's the theme, I guess, of your awareness campaign that you have begun now as a Department of Health.
Yes, in fact, we've been working very hard with a number of stakeholders like your Organ Donation Foundation, and also try to sensitize our healthcare workers also to alert the patient, the families of those who are in need of organ donation, but also who are also talk to the prospective organ donors to donate, to sign up for donation. But also what's more important is that in order to overcome all these cultural and religious beliefs, we also encourage the prospective donors to first discuss with their family members, their loved ones, about their decisions to sign up for organ donations, so that by the time they decide or whether they passed on, at least there are not going to be challenges as far as the organ donation is concerned.
Okay, let's talk about organ donation now. Just touch on a number of things, just to be practical for a short while, just as you create this awareness. Who can donate? Anybody
who's above the age of 18 years old can donate an organ, but also in terms of the age limit, at least somebody should be older, not older than the age of 75. Somebody should be healthy, but otherwise the doctors can also advise in terms of the healthiness of a person who can make such a donation. So the simple to donate, just to go to your nearest health facility, your doctor or your clinic, and ask more information about the donation. Otherwise, you can also go to the website of Organ Donation Foundation, who work closely with us in terms of raising this awareness, but also to save all people who are in need of these life-saving organs, like your liver, your lung, your kidneys, and the heart.
Is it a seamless process?
It's not a serious process per se, but for example, we always say one person can save up to 4 lives. For example, most people are not aware that myself, Foster, I can live a long and healthy life with 1 kidney. I can live a long and healthy life with 1 lung. I can live a long and healthy life with my part or segment of my, a liver being cut and donated to somebody who's in need of such liver. But the only challenge is the heart. Yes, we know that we've got 1 heart, so it's not easy to donate a piece of your heart. But with other critical organs like your liver, your kidney, your lungs, you can be able to donate and save somebody's life. But in terms of transplant, only those who are blood related can easily donate these organs without necessarily needing the Minister of Health's approval. But those who are not related by blood, they need an approval from the minister to sign. But that process is very quick, because we're able to get the application from the hospital, who is going to apply on behalf of the patient. Then the minister is going to consider that without wasting any time, because it's aware that this is about saving somebody's life. Then we'll sign them so that the process can quickly start.
Yeah, you said in your statement you've got over 2,700 people who are currently waiting for organ transplants. I would guess some of them will be children?
No, definitely, as we said, that the number currently we are sitting as 2,780 people who are waitlisted to receive this life-saving organs. But unfortunately, some of them, because you can see this is a long list, and this list is growing over time. So hence we encourage people to come forward to donate and save some of these lives. And we have lost about 189 lives of people who have been waitlisted for this life-saving organ. So we want to appeal to all South Africans to say, let's give by donating to save the lives of those who are in need of these organs.
Okay. So the first point you can go to if I wanted to be an organ donor is to speak to my doctor and say, I would like to be an organ donor. What do I do? Or if I'm brave enough and courageous enough, I can just go to the Organ Donor Foundation's website and I'll find out there how to go about it.
Yeah, firstly, you can go to your nearest hospital. You can go to your, we've got coordinators in all the provinces. You either go to your nearest hospital, you can go to your nearest provincial department, either province or the district, or you can just go to the Organ Donor Foundation, who will take you through the steps. But also, they're going to encourage you to communicate, first discuss with your family members or loved ones, so that we are all in the same page.
Okay, finally, which are the most common organs that you are needing, that are required currently?
Currently, the most commonly required or needed organs, we talk of your kidney, your liver, and the lungs, mostly the lungs and the kidneys because of a number of health conditions like your non-communicable diseases. We talk of your diabetes and hypertension, which mostly affect the functioning of your kidneys and the lungs. So these are mostly needed or much needed organs that are mostly needed by most of our people. So I want to encourage people to say, yes, Mohale, you can live with one kidney.
Okay, this is the last question before I get into trouble with my producer Zama here. In terms of time, do you pay an organ donor? I'm asking this because you hear all kinds of stories about people's organs being harvested, all kinds of fictional and mythological stories. If I'm a donor in this process that you've outlined the last few minutes, do I get compensated for it?
Remember, we say the word donation means you don't expect any financial reward. So the donor should not expect any financial reward. Even the recipient is not supposed to pay anything. Otherwise, what you are preventing is unethical behavior where people will engage in organ trafficking exercises where they mutilate people in order to sell their organs. So we say it's illegal to expect any reward to donate your organ, but also to pay for, as a recipient, to pay for the organs that have been transplanted into you.